Good morning, everyone. Happy Saturday. I hope everybody had a good week. Just getting myself situated here. Okay, so just going to wait for a couple people to hop on here, and then we'll get started because a lot of you watch this on the replay. All right, if you're on, say hi. Today's discussion is going to be on cholesterol, the good, the bad, and the ugly, right? So we've all heard about cholesterol, obviously, and the risks for heart disease. We know about statin drugs like Lipitor and Crestor. We've heard about the side effects from these medications. We know about low cholesterol diets, and there seems to be a lot of confusion out there of what people should be doing and how to even interpret their cholesterol readings. So first, we're going to talk about what is cholesterol. So first of all, cholesterol is something that not only you ingest, but it's actually made by your body. And the function of cholesterol, one of the major functions of cholesterol is that it is responsible for making your sex hormones like testosterone and estrogen. They all come from cholesterol. So cholesterol is not necessarily a bad thing. It's actually necessary and vital for life. So when we see that our cholesterol levels are high, there's a lot of things that we all have to look into, and that's going to be the main part of my discussion today is how we interpret our cholesterol tests and what tests should you be getting. So most people go to their doctor and they get a lipid panel, right? And you get HDL, which is good cholesterol, LDL, also known as bad cholesterol, and triglycerides, which are types of fats also that circulate through the blood. And the last thing would be your total cholesterol. So those are the components of your lipid panel. But unfortunately, that really doesn't say the whole story of what's going on. Hey, Demir, nice to see you on this morning. So cholesterol is a really, really hot topic right now because so many people are being told that they need to go on statin drugs because their cholesterol is high and their LDL is, 130 or 140 or 200. So what's the real story? And so the first thing you got to know is what are the particles and why is it important to learn about this? So you have two types of particles, basically. You have HDL, which is high density lipoproteins, and LDL, which is low density lipoproteins. So these proteins are what carry the cholesterol molecules around. So what happens basically is LDL tends to deposit cholesterol into your blood vessel walls and contribute to heart disease, and HDL is thought to actually be like a scavenger and remove these particles from your arteries, from the walls of your arteries. So that's the basics. However, it's not the whole story. So when you get a cholesterol test, the most important thing is to ask for fractionated cholesterol test. And the reason that's important is because this really tells you the whole story. See, not all LDL is bad. The LDL is further broken down into like these fluffy, buoyant particles, which kind of imagine them as cotton balls, right? And then there's there's small, dense particles, which are like little marbles, think of them as, right? So it's the small, dense particles that are ones that are really atherogenic. Atherogenic means they cause deposits of plaque in your arteries. So atherogenesis is the process of basically depositing plaque in your arteries, right? So we hear the term atherosclerosis. So it's important that you get the particle size, because you can have high LDL, but you have a favorable particle size. So in other words, let's say your LDL is 150, but most of that is these fluffy cotton ball-like particles. Well, then that's nothing to worry about, really, because those aren't the ones that clog your arteries. So there's no reason to go on a drug when you are not in need of a drug, right? And we know that statins have a lot of side effects. They affect your liver, they have toxic effects on your muscle, they can cause fatigue in certain people. So they have a lot of side effects. So, you know, if you do have high cholesterol, you've been told that you have high cholesterol, get this fractionated test. Now, it's the same thing for HDL, right? You have these small, dense particles of HDL and the large, buoyant ones. And the more of the large, buoyant ones you have, the better, right? So the large, buoyant are the good ones, and the small, dense are the bad ones. So, like, in other words, if you have all small, dense HDL particles, those aren't necessarily all the good ones that are going to actually remove plaque. So you want these large, buoyant ones that are going to actually remove plaque. So they're kind of the opposite of one another, or mirror images of one another. Hey, Janice, how are you? Nice to see you on here. So that's the story of LDL. Now, that being said, the most important test to get, if you're worried about cardiac disease and cholesterol, is something called a highly sensitive C-reactive protein, or cardiac C-reactive protein. C-reactive protein is a measure of inflammation in the cardiovascular system. And the analogy I have is that the blood inside of your blood vessels mimic the inside of your mouth, like the mucosa, or the inside of your mouth. It's kind of soft and very delicate, right? If you've ever bitten the inside of your cheek. So what happens is, when the inside of that mucosa gets damaged, right, your body looks to repair it. So let's think of like the inside of your mouth as your blood vessel. Now picture somebody who has high blood pressure, right? You have this high shearing force of the blood running through the blood vessels, which is going to cause damage to the inside of the blood vessels. Diabetes, the high levels of high blood sugar or glucose damage the inside of the blood vessel walls, which is why people with high cholesterol actually have more cardiovascular disease, because it's the toxic effects on the mucosa of the blood vessels that cause the damage. So how does your body look to repair this damage, right? So now you have this nick inside your blood vessel wall. It'll form a patch, and that patch is usually made up of cholesterol. So there's this cholesterol patch that's actually now making the opening of the blood vessel narrower. So now you have a blood vessel that's damaged that you're depositing plaque into for repair. So that's why it's so important to know the level of inflammation inside your blood vessel walls. Hey, Charlie, Dr. Charlie Francis, great having you on here, man. I'm a really big fan of yours, and inspired by all your videos, and you've really made a big difference in my life watching your videos and seeing your story. So it's a pleasure having you on here. If you guys get a chance, follow Dr. Charles Francis, great guy, really inspiring speaker. And if you get a chance, go check out his Facebook page. So basically, we want to get this highly sensitive C-reactive protein. So it's called a cardiac C-reactive protein. This is a direct measure of inflammation inside your blood vessels. So what causes damage are, like I already mentioned, high blood pressure, diabetes, stress actually can do it. Drugs like cocaine that could then cause damage by raising your blood pressure. Smoking damages the inside of blood vessel walls, which is why smoking puts you at risk for cardiovascular disease, right? Because it damages blood vessel walls. So the point here is if you have a borderline cholesterol and your doctor's concerned, but you have a normal cardiac C-reactive protein, I'm not too concerned. I don't think it's something that you need to jump on a drug right away. So to me, the C-reactive protein is the most important factor. And it's the reason why you see people who have really high cholesterol, but they never get heart disease. They never get a heart attack. But then yet on the other side, I've seen patients that have perfect cholesterol, but they still get a heart attack and they still have, blood vessel disease. And the reason for that is when you go back and you measure their C-reactive protein, they have tons of inflammation inside their blood vessels. So their C-reactive protein is really high. So they have a lot of oxidative damage to their blood vessel walls. So what that does is, even if your cholesterol's minimal or low, it's your body's still going to look to repair that damage. So whether you're high or low, it doesn't matter. The damage is there and needs to be repaired, and those cholesterol gets deposited into the blood vessel wall, and you start getting atherosclerotic disease. Now, over time, the calcium will start to build up on this plaque, and the plaque will go from a soft plaque to a hard plaque. So now your blood vessel becomes even narrower. So now you have these narrow blood vessels. You start to get symptoms like angina and shortness of breath. So it's a cascade of events, but it all starts from inflammation. And that's why antioxidants are so important, right? So oxidative damage, right? You have oxidative damage that's caused to blood vessels. So antioxidants, nutrient-rich foods are all very important. They're important because they reduce the stress and on the blood vessel walls and reduce circulating damage. So that's really, really important. The second major thing is, like, don't jump on a statin right away. Like, I know it's easy. All right, my cholesterol's high. I don't have time to exercise. I don't really want to watch my diet. And I'm just going to jump on the Lipitor and that's it. Well, Lipitor and these drugs have definitely statin drugs have saved a lot of lives without a doubt. But if you're borderline and you just go in and you have high cholesterol, you have to look at a lot of things. What are your risk factors? Do you have diabetes? Do you have high blood pressure? Do you have a family history of heart disease? How much alcohol do you drink? Do you exercise? These are all risk factors. And when you're going for a cardiac evaluation or even your general checkup, these are all things that are in your history, right? They ask about family, they ask about smoking, they ask about alcohol, they ask about other diseases. So if you go in and you just have high cholesterol, don't jump on a drug right away. Modify your lifestyle. I've talked about intermittent fasting. I've talked about, low carb, high healthy fat diets. These are all great ways. Increasing your exercise. Get your cholesterol down that way. Because the thing is that statin drugs do not reduce particle size. And I'm going to repeat that. Statin drugs do not reduce particle size. So they do not actually increase particle size. They have no effect on particle size whatsoever. So if you have a cholesterol panel which has a really bad unfavorable, we call particle size, you have a lot of these small dense particles and less of the large fluffy buoyant particles, then taking a statin drug only lowers the total number but doesn't change the proportion. So just to review that again, so statin drugs are not going to change the particle size, they're just going to reduce the total number. The only thing that really effectively reduces or changes or increases or decreases particle size, whether you're talking about HDL, LDL, is exercise and diet. So the only way to change that particle size over is to modify your lifestyle. The other important thing to remember about statin drugs is they can cause damage to the muscle, damage to the liver. If you're on a statin drug, pay attention to this. You must take coenzyme Q10 to protect your liver and to protect your muscle from the harmful effects of statin drugs. Statin drugs are great for people with a lot of high-risk cardiovascular disease, diabetes. However, they do have side effects. And the way you minimize these side effects is you can take coenzyme Q10. It's available readily. I would suggest starting with 100 milligrams of CoQ10. So if you have a family member that's on a statin drug, make sure they're taking CoQ10. The other thing is, again, go to your doctor, ask for a fractionated or VAP test or a more detailed profile. Request a C-reactive protein level. These are all things that you have to be proactive about, right? You can go to your doctor, tell him you have concerns, you have a family history, your cholesterol's been high, but you don't want to go on drugs right away. So get all the information that you need, right? Get as much information, get the inflammation levels, get find out if you have small, dense LDL particles, find out what your HDL is. If you have a high total cholesterol, but most of it's HDL, you're in great shape. You don't need a statin drug. I can't stress enough, like, how much diet has to do with this, because you could have high cholesterol and a favorable particle size, and you don't need a drug at all. You're actually at lower cardiovascular risk. And the way you change that particle size to a more favorable is a healthy diet, which is rich actually in fats. And that may not make sense to you guys, but healthy fats actually improve your particle size. They improve the favorability of your particle size. Exercise, of course, does that. But eating foods that are rich in healthy fats, coconut oil is fantastic. So if you cook with coconut oil, it comes as a solid. You can use it like butter, right? You just like butter melts. It's a solid fat. Avocado oil, olive oil. Here's a little caveat about olive oil that I'm going to throw in here. I don't know if many of you know it, but extra virgin olive oil is never to be heated. Extra virgin olive oil, the green one that looks really, really pure, is actually toxic when you heat it. So extra virgin olive oil is only meant to be served cold. Now, the regular olive oil is only really meant for medium heats. The only two high heat oils which don't denature into toxic substances are avocado oil and coconut oil. So those are your high temperature oils. So if you're frying, you should fry in avocado oil. So that's just a little tidbit to take home. Never, ever, ever heat extra virgin olive oil. Actually, you're doing more harm than good. Have a diet healthy in antioxidants, garlic, onions, fruits, vegetables, right? All of these things you can do to get this C-reactive protein down. So, like, if you're consulting with me and you're talking about your cardiovascular health, the first thing I'm going to ask you is, what's your C-reactive protein level? Because to me, I don't care what your cholesterol is. If you have a low C-reactive protein, I'm not too concerned, unless, of course, you have a lot of risk factors. And if you have a lot of risk factors, you probably have a high C-reactive protein. So it goes hand in hand. And then if you do have a C-reactive protein, then we can be more aggressive with the cholesterol monitoring. But if your C-reactive protein is good, you really shouldn't have to worry too much, and you definitely don't want to be on a medication. I'm going to keep this brief this morning and go to, if anybody has any questions. If you have questions later on, I'm going to scroll down and look. Hey, Jenna. We got Jenna, Janice, Rosemary. Hi, Eric. How are you? Rob. Hey, Dr. Fred. How are you? Peter. Yeah, so this is really good information. I hope that you guys enjoyed this. If you have loved ones that are on statins, remember, they can get off statins. Tell them to get a C-reactive protein. Tell them to find out what their particle size is, and then tell them that they need to be on CoQ10. If they're on a high dose of a statin, they may want to be as much as 150 to 200 milligrams of CoQ10. If they're on a starting dose of a statin, you may want to be only on 100 milligrams of CoQ10. So one last thing, I offered a special this week. So one of the things I do in my consulting business is, if you're interested in getting a program made based on your blood work, I do a consultation, usually over Skype or FaceTime or over the phone. We get a detailed history on what your concerns are with your health. I suggest the blood work that you should get done. You take that to your regular doctor so that this blood work gets covered under your insurance. And then when you get the blood tests back, we'll evaluate it, we'll reconsult, and I will design a nutrition and wellness program which will include food, exercise, and supplements based on that blood work. So this week I'm having a special on that. I posted it. It's $125 for that. It includes 2 consults and probably a third, and the texting service that I offer, which allows you to ask questions as they come up during the week. So again, this is going to be on replay on my Facebook page, and I hope you guys have a wonderful Saturday. I enjoyed having my Saturday coffee with you, and I hope you all have a blessed day. Thanks for joining me.